Okay, so today we're going to talk about how to put in an IV. So first, I'm going to go over the supplies that you need to put in an IV. Tourniquet, alcohol or something to clean the skin with, your extension set, a flush, an IV catheter, and then lastly something to secure it with. Okay? So first, let's get our extension set up. You're going to use the flush to prime your extension set first. And this one is a double where it hooks up to the IV right here. Otherwise, sometimes they're just singles. Either way, they work the same. So you want to, with the doubles, you have to flush both of them. And so I'll flush one and clamp it off. And then I'll leave it on this one. And so now your line is primed and ready to go. Set that back over here. So next, we want to put a tourniquet on. This will help us visualize the vein. So we're going to do it on the hand, and we're going to zoom in and take a look at all of the different sites that you can do an IV on the hand. So I'm going to place one in his dorsal aspect of his hand. So I'm going to put the tourniquet up halfway through the forearm, right about here. And tourniquet placement, people do it several different ways. I like to pull up with the other one, and then underneath. And that way your flaps are facing up away from the site you're doing it at, okay? So now we've got the tourniquet placed. We want to look at the hand, and as you can see, we've got several different choices here, like probably 1, 2, 3, 4, 5, 6. So I'm gonna do one of the smaller ones. I'm probably gonna do this one in the middle right here. Okay, so we're gonna clean it first. Really important to clean, and using your alcohol or your chlorhexidine. Sometimes going back and forth with some friction, with some pressure, can help make the veins come up even more to the surface. So sometimes if I can't see it very well, I'll kind of scrub, and that friction does the same thing as, you know, when you see people flick. Okay, we have our site thoroughly cleaned. Perfect. So get your IV catheter. You can have people make a fist with their hands. Sometimes that will also help bring the veins to the surface. Or you can just hold their hand with their hand, and you can pull down on the skin, and that'll help too. Kind of, you want to anchor it essentially. You don't want the vein to be moving on you, and if you try and insert it just like this, there's a good chance that it'll move on you and you'll miss. So you want to really anchor it with your non-dominant hand, okay? So clean again since we've touched the site. So here's our catheter. We're using a 22, and 22s always have a blue hub. So blue 22, if that helps you remember that. So when you insert your IV catheter, it always should be the bevel facing upwards. Okay. Again, let's clean again. And like I said, you want to anchor. You want to anchor the skin down with your non-dominant hand, so that way the vein won't roll when you try and insert the catheter, because the vein will naturally want to move away from it. So we're going to anchor it, and we're going to insert it at a 10 to 15 degree angle initially. And if you've hit the vein, you'll see a flash of blood in your IV. Okay, so we're going to angle it really well, or we're going to anchor it really well, I'm sorry. And we're going to poke. And you see that flash of blood. You want to insert it just a little bit more, and then you will push in. Now this IV doesn't stop the blood from coming out, so you really have to have good tamponade different IV catheters will stop the blood. So sometimes you'll have a little bit of a mess, but that's okay. So now we've secured our extension tubing here. You can pull back on it and you should see some blood in the catheter, and then flush. And then you shouldn't see any bubbling or any sort of swelling on the site. And you should have easy flush. You can also feel over the site and you'll feel the saline rush. That's how you know you're in, okay? So now we're in. You want to make sure it's secured properly. And depending on where you work, you'll have different sort of tegaderms. You want to put it over so you can see the hub in your little window here. I always typically will flush again to make sure it's still in a good spot. And then in this setup, I call these the pants, and you always want to put the pants on. Just like that. And then you'll usually have another piece of tape or something in your set to anchor in your rest of your extension tubing. Okay? And that's how you properly dress it when you're done.